When we collect stem cells for multiple myeloma, we often collect more than, stem cells for more than one transplant. Now, practices vary across institutions. Some institutions collect for 2 transplants in all patients, some collect in selected patients. At our institutions, we collect enough stem cells for more than 2 transplants in almost all patients. And so what we investigated was, in how many patients do we actually use these second backup stem cells? And we found that we use these backup stem cells in less than 10% of patients, mostly for a second transplant, and rarely, less than 2% for a stem cell boost in case of delayed engraftment. And so this brings up the question of whether we should be collecting stem cells for a second transplant in all patients. And I think this needs to be investigated. Clearly, the resource utilization is low, but the challenge is we sometimes need a backup stem cell boost in some patients, and it's hard to predict which patient will need a boost. And at this time, therefore, we continue to collect for more than one transplant, but I think going forward, we should look at which patients don't use their backup stem cells and try to eliminate collection of backup stem cell in those patients. Our results are very similar to results from a study published by Medical College of Wisconsin, and they similarly showed that backup stem cells are used in less than 10% of patients for a second transplant. Their rate for a stem cell boost were also similar to ours. I think it's also important to note, now that we are using CAR T cell therapies, a lot of patients may need stem cell boosts for low blood counts after CAR T cell therapy. So that might be another use of stem cell boosts going forward. So more to come on, use of backup stem cells. I think we need efforts to understand which patients will utilize them so we can improve our resource utilization and decrease collection for patients who don't need these backup stem cells.